Hi guys, I chose goal 15 from the National Patient Safety Goals program. This goal was implemented due to higher reports of suicide happening in 24/7 healthcare facilities, whether that be in psychiatric hospitals or hospitals in general. So the goal of this goal is to reduce the risk of suicide in these organizations. So this goal will apply to psychiatric hospitals as well as organizations that screen patients with the risk of suicide or behavioral health concerns. So basically, it consists of an array of protocols that help hospitals identify patients that are at risk for suicide or behavioral health concerns, and also gives protocols on like how to prevent it from happening. So these assessments might include environmental risk assessment, which specifically tackles the environment. If a patient is deemed to be at risk for suicidal ideations, homicidal ideations, or behavioral health concerns, there's a protocol put in place in order for staff to make sure that the patient is safe as well as themselves are safe. So they will go into rooms, make sure that there's nothing in rooms, and these objects. So these rooms are basically assessed for anything that can harm a patient or their staff. So rooms with cords, sinks, large objects like chairs, desks, extra blankets or sheets, things that can be used to hang patients, are obviously going to be removed from these rooms. So they're going to be their environmental assessment. I know that there's also screening involved, which involves asking patients questions to test their mentation and see where they stand as far as suicidal ideation. So these questions might look like asking a patient if they are suicidal, want to harm themselves or others, have suicidal ideations in the past, a little bit about their mental history, any medications that they're on, so that nurses and staff can better address the situation and how to prevent something like suicide from happening, but also make sure that the patient is safe while they're in their care. So another important thing to note in this goal is that everything must be documented. So if a patient is deemed to be at risk for suicide or harming others, this must be documented in their chart. So if a patient comes into the ER and they're deemed suicidal in the ER, make sure that their environment in the ER is safe and they're staffed up, they have security guards, their room is clear of all types of things that can be used to harm themselves or others. They must note that this process is happening. So they must go in the chart and specify that the patient does have suicidal ideations and the protocols that they took to make sure that the patient and themselves were safe. So that way, if the patient comes in for a medical reason and they have to be admitted into the actual hospital, that the staffing upstairs or wherever they end up knows that this patient is under this protocol. After these assessments are done and a patient sees a doctor and the doctor makes a determination on what happens to the patient after, the patient will either go to an inpatient psychiatric unit to be further evaluated by a psychiatrist, or they could be sent home with resources. So if the patient is sent home with resources, there must be resources for follow-up care, which may include seeing a psychologist or going to mental health centers such as CMH, which I know is in Saginaw. It's community mental health. And that must also be documented in their chart so that there's a course of action, there's a plan, and the organization knows that the proper steps were taken and protocol was followed in order to prevent anything from happening in the care of the hospital, but also at home after discharging. I know that working at Covenant as a CNA in the emergency room, Covenant has a very extensive protocol for patients that come in with behavioral or mental health concerns. And that looks a lot like this goal, which includes screening the patient, asking if the patient has any suicidal ideations or homicidal ideations. If a patient is deemed to have these thoughts, then they are immediately taken back into a room. They don't sit in the waiting room. They're immediately taken back into a room. All of their things are taken from them, all of their belongings, their clothes, their phones, their wallets, necklaces, jewelry, anything that could be used to harm themselves or other is taken from them. They're put into a gown and normally into a room with nothing but a bed and sometimes a TV. There is medical equipment in these rooms, but they're locked behind a shed. So the only way that a patient could get access to that would be if security unlocked it. So there's also security at the end of each hallway in case patients try to elope or harm anybody. There's readily security close to help address patients for high-risk violence and suicidal ideations. So we appreciate the importance of this goal because not only does it keep patients protected, but it keeps staff protected, and it will lower suicidal rates in organizations.